Hi there. I want to talk about reinforcing neural pathways of learned helplessness and how that sets people up for addictive behaviors. Um, some examples of this are we reference addiction as a disease. We do it often. It's even kind of just like common language. I was watching a show. It's called Heartland. It's a Canadian show. It's just about a horse ranch, and one of the characters dies, and his mom doesn't show up for the funeral, or she doesn't show up for a year. And then when she finally shows up, she said she relapsed and she was in rehab. And so then the the wife of the guy who dies is forgiving her. She says, um, addiction is a disease, it's not a choice. So, we can, technically, if you look at the definition of disease, yeah, it applies to addiction in some ways, but for most people, when you use the word disease, that implies that it's not within their control, like cancer or whatever, other diseases that are really not within your control. Um, so when people look at it as a disease, that's one of the things that reinforces those neural pathways of helplessness. I don't have a choice. It's a disease. It's something that's happening to me. And then, I've talked before about the different diagnoses that there are. This is who I am. I'm depressed. I have an anxiety disorder. I have ADHD. I have OCD. I have addictive personality. There's a lot of those diagnoses that also reinforce the pathways of helplessness because it's just who I am. And I've even heard it from my clients, I've got to have something, or I will act out in some other disordered way. I'll become more depressed, I'll become suicidal. So it's like, again, neural pathways of helplessness. I've got to have something. I can't stand it, right? Or something terrible is going to happen if I don't engage in my addictive behavior. Um, and truthfully, most people get depressed and anxious because they feel helpless, not having an effective way to deal with their addiction. So, treating depression and stress and anxiety to try to alleviate addiction is ass backwards, right? So, there's more, like with food compulsion, people blame the food. It's the corn syrup, right? Or it's the government or the doctors and the pharmaceutical companies are trying to keep me addicted. It's a conspiracy. Somebody made me do this, right? Rather than whatever made me want to engage. There's going to be a lot of things make you want to engage. Then having tools in the moment to make a choice, in the moment based on your long-term best interest. There's avoidance. I can't go near fill in the blank, alcohol, can't go to the bar, I can't go near cookies, whatever it is, can't go in the casino, or I'll get out of control. Versus if I'm triggered by those things, I may want to get out of control, which is very different when you have a way to deal with the wanting, that addictive desire, and it puts you in a position of power empowerment versus that helplessness. I'll just get out of control, right? Or the idea, just distract yourself, go do something else, right? There's a lot of advice for distracting yourself when it comes to these addictive desires. But there, that thinking is those neural pathways. I can't let myself think about it, because if I do, then I'm going to act on it. Rather than, if I think about it, then I may want to act on it. And again, it's, you've got a tool in the moment to make a choice when you have that addictive desire. Empowerment versus helplessness. And I really understand that when you don't have an effective tool to deal with that addictive desire, it feels like you don't have a choice. I get it. I understand that. So Beyond Compulsion, I can provide that tool to deal with the addictive desire in the moment, and again, make a choice in the moment and not have to act on that desire based on your long-term health, happiness, and peace of mind. My class is available online, and you can click the link below, and please do subscribe to the channel. It would help me a lot. And also share it with your friends. There's so much addiction out there, so many people struggling. So I appreciate any of that you can do, and I appreciate you listening, and have a great day.